Welcome to 10 Questions with NBC 10 Boston. I'm Kwani Lunis, and as we mentioned in our last piece this month, it is Women's History Month, so we wanted to make sure that we were honoring as many women as we could and hear a little bit about their stories. So that being said, we have Dr. Sabrina Assoumou here with us today. She currently is at Boston Medical Center and Boston University, specifically specializing in infectious diseases, which, as we know, this last year, we've been dealing with that. So with that being said, welcome, Doctor.
Thank you for having me on.
How has your day been so far?
It's been a busy day, but every day is busy these days. So
Right, exactly. And as I mentioned, we will definitely get to the pandemic itself, but I do want to first start with your personal story and just get a sense of how did you get into the medical field? What inspired you to want to become a doctor?
Yeah, that's actually a good question. So I was actually inspired to be a doctor because of my uncle, who was a family physician in Brooklyn. And he was one of the very few physicians who at the time was still doing house calls and going to people's houses. And he was a family physician, so he saw the whole family. And during the summers, I had an opportunity to work with him. And I just love seeing his relationship with his patients, seeing how much he loved them, how much they loved him, and really seeing the difference that he could make in people's lives in general. And so that was definitely why I wanted to become a doctor.
Were you originally from the New York area?
No. So my family lived in Maryland, and I was actually born in West Africa in the Ivory Coast.
Nice. Côte d'Ivoire.
Yes, Côte d'Ivoire. Yes.
My mom would be so proud. I tried to bring out the French. So how would you say, maybe, you talk about being from the Ivory Coast as well. What kind of influence does your culture have on not necessarily your career itself, but maybe kind of molding you throughout your life and career?
Yeah, no, I think that was definitely a strong foundation. It's the saying, it takes a village. Mm-hmm. And I think that growing up in Africa definitely made me feel like I was part of a village, and that family was very important. And I think that for me as a physician, it's really helped me try and understand people's stories, because so much of understanding and being able to take care of a whole patient is really understanding where they're coming from and where they fit in the bigger picture. So I think it's definitely had a big influence.
And going back to the actual medical career, I know you went to Williams College and studied there. What was the collegiate experience like for you when you finally I'm sure you had to declare pre-med at one point. Was it easy for you? Was it something that you kind of caught on easily, or was there a struggle at any point?
So as I said, I knew what I wanted to do. And it's funny because that you mentioned that, because actually last week we had a class reunion for Williams, like virtual, where they brought together different people who were involved with, doing anything related to COVID-19. And we all talked about our experiences. And it was really nice to see everybody. But it's interesting because a lot of people don't really remember me from Williams College, because I was the girl who was in the library studying all the time. And so I was very focused. I knew exactly what I wanted to do. I had a very, small knit group of women who were still friends. And actually through COVID, we've actually done more Zoom calls. And we actually had a Zoom call last weekend to celebrate a friend's birthday. So I've really formed some really strong friendships. But I was definitely, to go to medical school, you really need to be focused. And I was definitely very focused early on.
And you mentioned a really good point. There is a lot of, I think, isolation that comes when you want to be good at something and you're studying and putting a lot of time into it. So throughout the college journey and maybe even your residency and beyond, what was that? Was it challenging to be so isolated and study and really dive into this career at the beginning?
Yeah, no, it's really hard. I mean, medicine, there's just a lot of sacrifices. And I knew that. It's funny because my uncle told me too from the beginning. He was like, it's a lot of it's really rewarding, but it's a lot of sacrifice. There are times when your friends are like, having fun, traveling, but you instead have to either do an internship or study for your boards. So I knew that it was going to be hard, but the thing that kept me going is knowing the impact that I wanted to have on people's lives, and also knowing that it would also allow me to do what I want to do, and also the flexibility. What I've enjoyed, especially with my position now, is I get to be the doctor that I always wanted to be. Like I often say that, and by that I mean I always wanted to work with immigrant population and the underserved community, and working at Boston Medical Center has definitely allowed me to do that. but also in the position that I have. So a lot of my time is actually spent doing research and asking questions and having the flexibility to answer the questions that I think I'm interested in. So the research part, but also seeing patients and also thinking about how my research is actually going to influence policy. So kind of medicine allows you that flexibility. See patients, do research, do some policy, do some administration. So I really like that. So I think that the sacrifice was worth it.
Yeah, and you mentioned the patient aspect when you're able to relate to maybe one of your patients who may not have seen a Black doctor before, a young girl that may have not seen a Black female doctor before. So you mentioned the research and turning that into policy at times. How important has it been for you to be a woman of color in a role where you can eventually, I think, make some kind of impact?
Yeah, one of my favorite stories I can tell you, and I tell it a lot. It was a memory. So I did a combined internal medicine pediatrics residencies. That means that I saw kids and I also saw adults. And one of the cases that I still remember up to now, one of the first patients that I saw as a resident was a little girl who was about, I think she was probably like 4 or 5 years old. And I can remember the smile on her face when I walked in the door, and her mom she was a little Black girl who's like, 4 or 5 years old. And her mom told her, "This is going to be your doctor." And she opened her eyes and she looked at me because I could tell she'd never seen a doctor who looked like me and a doctor who looked like her. And you know what they say, you can't be what you can't see. And it's so true. And I'm hopeful that like one day she'd realize that, being a doctor is definitely something that she can do, and that, the sky's the limit. So I think that leading from where I stand and also being at the table is so important. So yeah, that has definitely influenced my career and my trajectory.
What are some challenges that you may have had to deal with, and as a result of being a woman, maybe being a woman of color in a not, probably predominantly male industry or field?
Yeah, I mean, one of the hard parts is often, being one of the few in the room, one of the few at the table, and to often feel like, there are not other people who look like you who are there, and sometimes you feel like that perspective is missing.
Right.
And especially, so the positive aspects of it are that I feel like I can relate to my patients and understand. So like there are certain stories that they'll tell me or talk to me about that they may not feel comfortable talking about or addressing with necessarily other healthcare providers. So it definitely allows you to connect in a very different way. But, being in a position where you're underrepresented in the room, it could be challenging. Sometimes feeling like, maybe your voice is not heard or not getting an opportunity to participate in things or in projects. So there's certainly a lot of challenges, especially nowadays.
Absolutely. And as I mentioned, you are specifically dealing with infectious diseases. Obviously, the coronavirus is not the only infectious disease on this planet, but why did you choose that field specifically?
Yeah, no, I actually chose infectious disease because I love puzzles. I love figuring out, and I think if you talk to, I don't know, whenever I tell people what I do, I often use the example of, I'm like, have you seen the show House? He's an infectious disease specialist. And so people know about, like, he was someone who thought about mysteries and try to solve problems. And that's definitely what we're known for. Like, I remember one time when I was a resident, one of the consults that I remember the most was the team asked for us to come as infectious disease. They were like, this is not an infections, but I know that you guys are very good about solving mysteries. So please. So that's actually one of the reasons why I picked infectious disease. Another reason why I picked infectious disease was because I was very much interested in global health. And so much of global health is infectious disease. And so, my love for puzzles and my love for like the world in general and feeling like a citizen of the world are the reasons why I selected infectious disease.
And you mentioned that you have the master's in public health as well. So what was the reason why you felt the need to specifically get that degree as well?
Yeah, so I got my master's actually during fellowship. So after, I did med school, then I did 4 years of a combined internal medicine pediatrics residency. And after that, I did fellowship. And during that time, I got a master's because I wanted to learn how to be really good at asking scientific questions and knowing the skill set to actually answer those questions. So I took classes in like biostatistics and like study design, and this was great because that kind of set up the rest of my career. As I said, I spent a lot of my time, and actually most of my time, doing research because I'm on an NIH grant. And so the skill set really helped me to be able to, design a study well and actually answer questions and determine if is what I'm getting valid or not. So that is actually why I got the Masters of Public Health.
And you mentioned the grant. You said the NIH grant? For those who don't know, including myself.
Oh, yes. Yes. Sorry. So I have what is called an early career mentoring award. So it's a 5-year NIH award. And as someone said, described as it's like a gift. It's a gift from the NIH that protects my time for 5 years so that I can develop to become an independent researcher and be able to get my own grants and answer my own questions. And so during those 5 years, I spent time taking additional classes, working very closely with a mentor, with the goal of being to the point where I could be independent and run my own studies. I was actually very fortunate. I feel very fortunate to have had one of those awards. I think when I looked at the stats the last time, I think that only about 2% of people who get this kind of award from the NIH are Black. So there's just not many of us. So I have my mentoring team and the people who supported me over the years to thank for being able to have this opportunity to grow professionally.
And it seems like with your role, even college and beyond, you're always learning. And I'm sure this past year has been a full learning experience for you. But like I mentioned, March 10th is the year to the date of when Massachusetts did decree the state of emergency. And, a lot of us probably didn't even realize the severity of what this virus was really going to be. So maybe for the people that are not in the medical field, when did you find out? And what was that process like of, maybe doing more research or figuring out ways to, as you mentioned earlier, impact society and probably for the better?
Yeah, no, I think I'll always remember that weekend. It was that same weekend where we knew what was going on in Italy.
Yeah.
But we were having like more frequent meetings in the infectious disease like department section about cases, and we were waiting because we knew that case was going to come to the hospital. And I remember a bunch of us infectious disease physician on the call trying to help the on-service team, the team that was on call, trying to figure out how to handle that particular case, which later turned out to be the first case that we had of COVID-19 at Boston Medical Center. And then the floodgates opened, and it was very hard. I mean, the whole hospital was transformed because one day we had no patients, and then the next day we had, hundreds of patients to take care of. We all got together really quickly and mobilized and rearranged the whole hospital, put together protocols because it was, it's a new disease, new illness, and we kind of divided and conquered. People put protocols for like, what do you do when patients get admitted? How do we take care of the patients when they're admitted? Because at the time we had pretty much no treatments that were approved, that were known to work. And the patients were very sick. I mean, the patients would come to the hospital and, were very sick and needed to go to the ICU relatively quickly. So it was definitely a very difficult time.
You mentioned earlier that with your role, a lot of times you're doing research, but a lot of times you are practicing in these hospitals. Over the past year, were you in the hospitals a lot working with patients, or were you doing maybe a little more research on that end?
Yeah, I've done a combination. It's funny because no matter what our role was or like, what else we had going on, we pretty much tossed everything to the side. And, as I said, I'm on a research grant, so I was not scheduled to do a lot of additional service time, but we all had to change our schedules and chip in and be on service. So I did a combination of different things. So I took care of patients at the hospital when they were admitted. More as like, I was the infectious disease specialist on service. And so we make recommendations and help, especially, it was a new disease. No one knew like anything or what to do. And so we were definitely, some of the specialists who were really in the forefront of making decisions at the hospital. So I did that part, work as a consultant. And I also led actually the protocol when I was one of the leaders of the protocols to determine, what are the criteria that we should be using to admitting patients to the hospital? And also, what are the criteria that would reassure us that patients are ready to be discharged to the hospital? So I was very involved with that process, and also with other things. Also, I was part of the team that was putting together the protocols for treatments and looking at like the data that was out there. What were the newest treatments? Should we just modify our protocol for what we should be giving to patients? And we were also at the same time also trying to look at our data, like what's happening with the patients who were admitted, like were the protocols making a difference? So kind of involved at different stages with like, taking care of patients clinically as a consultant, developing protocols to figure out what's going to happen when patients get admitted, and also looking back at our experience so that we can learn from it and actually take better care of our patients.
What is something that you think not only can doctors learn, but the general public can we learn from what we've experienced over these last 365 days?
So much. Well, I think, I'm just going to talk about it at different levels. So one of them is, as I've reflected back, on this past year, I think one of the big lessons that I've learned, and I think it was, we knew it, but it was even made more obvious, is that we're all connected and that none of us is safe until all of us are safe. We can stay in our little bubbles and think that we're going to be fine. But, if there's a variant that develops somewhere in a different country, and we don't make sure that we provide access to everyone to vaccines and safety with travel and globalization, it's going to eventually come to our little bubble that we thought was safe. So that's what COVID-19 reemphasized, that like we're living in a global world and global society, and that we're all connected and we all need to help each other get to the new normal. So I think that was a very important lesson. Another lesson was, leadership and clear communication to the public is so key and important. When we look at like the experience here in the US and we look at other countries and other experiences, one of the key things is having a very clear message that expresses to the population that we're all in this together. And these are the things that we have to do to sacrifice so that we can get to the other side. And, looking at places like New Zealand, they were able to get to the other side, at least for now, without a vaccine. Right? I mean, don't get me wrong, they're an island, they're a small, homogenous population, but you look at some of the Asian countries. So there are definitely a lot of lessons learned.
Virus aside, pandemic aside, medicine aside, what do you do outside of work? Like, how do you decompress as someone who literally has the world on their shoulders, I think, a lot of times?
Yeah. So I actually was in college, I just ran for pleasure. And I never considered myself a true runner. Like I've done a Boston half, like maybe 10 years.
You've done a half and you don't consider yourself a runner?
No. I do it at like different times of my life when I'm like, I really need to get into shape and like practice what I preach. I tell my patients, you have to exercise. I need to be more. So the interesting part was actually before the pandemic, I had actually signed up for the Boston, one of the Boston halves, the Run to Remember in May. And it was canceled because of the pandemic. It was switched to a virtual half marathon. So I did run it, and I did the virtual run on my own in my neighborhood. So I must say, like the thing that I do is I definitely run. I do long runs on the weekends, and I try to run during the week, which is a little bit harder to fit in. But I think what I like about running is it gives me time to myself, time to reflect. And, life can be so complicated and busy, but it allows me, and especially now where the routines are all different, like, it's not, we don't go in, it's not like same routine where, you commute, you go up and down the stairs at the hospital. There's less of that happening. So I think that it was really important for me to at least do something remain fit. And I might say, actually, I'm probably, I've actually been exercising the most consistently ever in my life for the past like few months, because I forced myself to do it.
That's so great. Congratulations on that.
Thank you.
I know a lot of people are still struggling. I think we've all gone through this roller coaster of like, oh, it's almost over. And then, oh, I'm going to get back in shape. At least I have. I don't know if others have as well.
I hear you.
My final question for you, though, I mentioned Women's History Month, and like I said, you already have and are continuing to make a difference, I think, here in the Boston community and even beyond. What do you want your legacy to be when it comes to the impact that you have on the field of medicine?
You know, I think that if there are more people who look like me, who, because of either seeing my work or having me mentor them, you know, join the field of medicine, and especially, and then continue that legacy, like that to me would be one of the most important things, the most important contribution. Because as I said, like, you know, it's hard to, you can't be what you can't see. Right. And a lot of the times not seeing others who are there can feel like a very difficult task. But I think that an important legacy is, you know, which I've been really fortunate to benefit from other people who have taught me about what we call the hidden curriculum in medicine. There's just certain things that you don't really know because it's not written anywhere, but you learn it if you have people who are supportive and who are teaching you these things that are not written anywhere, but that are so important. Yeah. So I've made it my sort of my job to kind of help other people so that they are prepared, because without preparation, it's really hard to succeed. And so it would be wonderful to have that as a legacy.
I think you're already well on your way. You mentioned that 4-year-old patient that you had. I'm sure that you already etched a memory in her mind for sure. Dr. Sabrina, thank you so much for joining 10 Questions with NBC 10 Boston today. And thank you for all the work that you've done over the last year.
Thank you for having me on.